Gloria Macapagal Arroyo.
Si Benigno Aquino III.
Rodrigo Roa Duterte,
do solemnly swear
do solemnly swear
Ako, si Ferdinand Romualdez Marcos Jr. ay taimtim na nanunumpa. Natutuparin ko na buong katapatan at sigasig ang aking mga tungkulin bilang Pangulo ng Pilipinas.
In almost 4 decades, the PIA has evolved and strengthened its mandate, committed to provide access to information in order to enhance the people's capabilities in decision-making and promote participation in nation-building. Today, the agency continuously strengthened the government's communication capacity towards transforming Filipinos to be thought leaders for the nation. With 16 regional offices and 78 provincial information centers across the country, the PIA is the largest communications network in the Philippines. The PIA engages with the public, making the government seen, heard, and felt. Now, under the leadership of Director General Jose A. Torres Jr. and the guidance of Presidential Communications Secretary Cheloy E. Velicaria Garafil, PIA aims to make Filipinos understand the different policies and programs of the national government while utilizing a whole-of-government approach.
Our unwavering commitment to progress, backed by the collective efforts of our dedicated officials, will undeniably yield tangible benefits for the region and its people. I assure you that we at the Philippine Information Agency stand committed to our role in disseminating relevant and timely information about programs and services. We will continue to ensure the successes and impact of these initiatives reach every corner of the country,
focusing on development communication and providing communities the access to information, making government policies and programs real, authentic, meaningful, and sustainable in the hearts and minds of every Filipino. Paving the way in communicating the delivery of public policy, PIA continues its legacy by becoming strong advocates of participatory governance, providing factual information dissemination, promoting effective communication for change, boosting social marketing and mobilization, usage of innovative media advocacy, promoting active community participation, and embarking the digital era of media. As the PIA looks forward to a bright and united Philippines under President Ferdinand Romualdez Marcos Jr., we continue to inform, inspire, and innovate. Because we are the Philippine Information Agency, enablers of Philippine development.
Mayong hapon, Davao Region, and welcome to another episode of One Davao Virtual Present. Today is March 25, Monday, and this is another episode aired live through the Facebook page of PIA Davao Region. We will also be aired later at PTV Davao, Republica FM1, and Davao City Disaster Radio. Mayong hapon sa tanan natong listeners and viewers. Karong hapon na isgutanan nato ang bato or kidney because recently bago lang ta nag sa ulog, I think it was in March 14, no, World Kidney Day, and there was this event sa SM, parang screening. It was participated by some of my office mates there is Philippine Information Agency. So to join us karong hapuna, we are happy, no, na atong suki na sa PIA, no, press con si Doc Dr. Maria Theresa Badang, and she's joined by Dr. Alrick Escudero, nephrologist of SPMC. Mayong hapon, doctors, ma'am.
Good afternoon.
Maayong hapon sa inyo, Sir Rodolph.
Okay, bago lang tanag ko we'll just celebrated okay, opening statement para sa ating guest. I think si Dr. Alrick bago lang nako siya na
Yes.
kita because ma'am, we've always
Suki.
been suki na dito halos every year, and I will also be ma-follow up because sa mga trends karon or mga data about atong kidney problem, because I think every year we are increasing 10%. I remember 10% nag-increase atong mga end stage renal disease.
Correct. So, siguro unahan ako siya, Sir Rodolph. So good afternoon, everybody. Thank you for this opportunity from PIA, Ma'am Jemin and Ma'am Karina for inviting. At the same time, Sir Rodolph, for having us. So I am happy to be here to spend time and to share information sa mga nagkadaghang problema sa kidney disease. And March 9 is actually a World Kidney Day. March 14 for this one. We just celebrated the World Kidney Day, which is a celebration. 18 years na kami na nag-celebrate ng World Kidney Day. Joining the world for 18 years, and this is to prevent kidney disease. And this is every second Thursday of every March. So we consider March as a kidney month also.
Okay, Dr. Alrick, nephrologist as
Good afternoon. We are here to promote every March World Kidney Day. It's a celebration to bring information to all the people around, and increase the awareness of chronic kidney disease in our country, So basically, based on the statistics, one Filipino every hour will develop CKD. Based on the 2016 data, there are about 2.6 million of Filipinos already who have CKD, So the increasing burden of the disease is always there, and that's why we would want to do this regular activity to promote awareness para maiwasan nato na ang mga tao adto sa end stage, or madialysis, So basically, as early as early screening is very important, and able to prevent the complications of chronic kidney disease, as well as awareness, of the things that we should eat, and what to avoid,
Okay, for the information sa mga atong audience, for Dr. Maria Theresa Lorenzo Badang is the head of the head of section nephrology and dialysis unit of the Davao Medical School Foundation Hospital, FKC Metro Davao Medical Research Center. She's also the head of the Southern Philippine Medical Center Kidney and Transplant Institute, and the past president of the Philippine Society of Nephrology Mindanao Chapter. Si Dr. Alrick Escudero is a nephrology fellow sa Makati Medical Center, Internal Medical Medicine Residency Makati Medical Center. So we are joined by our mga experts sa larangan ng kidney, and also they will be tracing us usa tong situation karon sa region, lalo na kasi si ma'am is she's dati updated yung every year, ang percentage rise ng sa rise ng kidney disease, lalo na yung end stage, no? And kailangan, di ba, right now marami na tayong dialysis centers. Kamusta na ba yung situation natin dito sa region?
Okay. So Rudolph, to add on this, Dr. Alrick is one of the the head of the World Kidney Day celebration this year. That's why he brings with us the younger face of God. Kasi baka nagsasawa na kayo sa akin, may mga younger nephrologists. We are now ang mga nephrologists to answer the need of increasing number of patients. In Region 11, we are 25 nephrologists already. So we have new nephrologists coming in with new knowledge and technology for us to prevent kidney disease. So in the update, yes, it's true that it's 10 to 12% increase in the chronic kidney disease. And the last World Kidney Day, we have a visitor from the Phil 12% every year. So the PhilHealth, sa last publication nila during the COVID times, there's a 90,000 patients on dialysis. That's 2020 to 2021, 2022 data. But right now for Region 11, for our data, we have, the PhilHealth has given 900 million pesos for kidney dialysis treatment only. And it's the highest that the highest case rates that they give for a specific disease. So it's a thing that we have to look upon kasi dumadami sila. And previously, we want to intensify because the answer, although it will help patients to have more dialysis units, is not to create more dialysis centers, but to stop this from happening. So the focus right now is for the Philippine Society of Nephrology is to stop CKD. So identifying them early is of crucial na effect. So Sir Rudolph, ang nakikita lang natin kasi na nagda-dialysis, that's only 10%. The 65% of most of the kidneys in stage 1 and 2, the 20% is in the 3 and 4. So yung mga 25% 3 and 4. So ang 10% lang yung nakikita natin sa dialysis. So that's how big our problem is. So that's why we're here with Dr. Escudero to talk about that and how to prevent it, not like enjoying of course dialysis has improved these past years, but we want to prevent CKD.
To Dr. Escudero, no, as what Doc Bagadang has said, no, na umi-increase 12%, I thought it was 10%. But with this, no, what's the significance and emphasis in this year's celebration of World Kidney Day?
All right. So the emphasis on this year's celebration for World Kidney Day is basically increasing the awareness of kidney disease, no, and early screening, no. So basically, one of our goals, for this would be to promote awareness and early screening. So during our activity in SMCT Mall in Ecolan, we had screening for diabetes, monitoring of blood sugar. We also had screening for uric acid levels, and a urine albumin screening as well, no? So these are early signs to detect possibilities of kidney disease, no? So early detection may prevent complication, no? So basically yun yung pinaka-goal talaga natin. So as early as doing the regular test, no? Even just a urinalysis would already be able to detect, no, if you have early signs of kidney disease.
Okay. Yun ba sa SM? So how many, how were we, I think it was parang well known siya kasi maraming nagsabi na punta sila sa SM mag-screening.
Yes. Approximately we approximately had around mga 300 to 400 participants during the celebration, no?
Yung screening ba pagkatapos ng World Kidney Day, is it continuing na program? Kasi many people will kuha na, may gasto yan. Diba? Yun yung kuha natin. Hindi sila magdoktor kasi they equate it na gasto, labas ng pera. Especially yung sa ating mga indigent, mga residents. No?
So, in line with that one, we partnered with the city government. The city health office is really supportive on this one. So the screening is not just for one day. It is in the barangay level already. The screening, there's urinalysis in the barangays, and there's a basic FBS screening and hypertension screening, because diabetes and hypertension is the number one cause of kidney disease. So the barangays, and even for SPMC, even adopted a barangay, the barangay in Agdao, so that the people there, it's like a pilot screening, sir, that all the people will have, we will see the number of people na naga-dialysis, na-proteinuria. So that's what we, Dr. Escudero, and the other nephrologists are seeking, to know how many people will have proteinuria. So that's the first sign of your kidney disease. Having yung bula-bula sa ihi, yun yung may protein sa ihi, yun ang dapat tingnan mo, makita na siya sa ihi nato. That's what we would like you to know, because once you have proteinuria, you have a form of kidney damage already. Do not wait for your creatinine level to go up, because the moment that your creatinine level goes up, it's 50% na na-destruction ng kidney mo.
So after nang meron silang mga proteinuria, yung sa barangay, how will you, ano yung steps after that para to prevent destruction?
So, in line with the universal health care, nag-start na kami ng process with the universal health care that all the primary or the basic healthcare unit will have this screening. Once they will be screened, they will be referred to a higher center. Dr. Alrick will siguro would tell us on who are the ones do we refer to the nephrologist.
Yeah, so actually one of the risk factors, no, so people who have the highest risk factors for chronic kidney disease are those patients who are diabetic. That's number one. Number two is for patients who are hypertensive or high blood, no. Number three is patients who are overweight or obese, no. They also have a higher risk for progression to kidney disease. And those patients who have a strong family of history of kidney disease, no. So if like in a family na ay mga relatives na like the dialysis ug sayo, so that's also a high risk for screening, no. Need to be checked by early check para makita if nagi genetic problem as well in terms of kidney problems, no.
Okay. Doc, yung situation, di ba 12% ang increase? Even ako region ba na 12% ba yung increase of kidney disease, CKD cases sa Davao region?
So it's really something that even the city, it's number one, it's the number 5 mortality na ng Philippines ngayon ng CKD. So sometimes they present na mag-heart attack or sometimes nag-stroke, but actually basic nila, may CKD na sila. So hindi lang sila na-screen, because kidney disease is also a vascular disease, meaning ang kidney disease, sakit din sa ugat. So it comes with hypertension, comes with diabetes, masisira ugat mo. So the kidneys is like an organ full of ugat. So pag nasira yung mga vascular system mo sa kidneys, tatanda na siya early, yung mga number of cells mamamatay. And so pag yung cells ng kidney mo is only less than 15% functioning na, then that's the time you need dialysis. So pag 50% ang nadaot, then that's the time you will only see yung creatinine mo tataas. Pero the damage is starting if you have lost your filtration capacity, meaning hindi na magsala imong kidney, lalabas ng protein. So that's alarming, because you don't see it unless you have to screen it.
Okay. What are the causes no, na bakit ulit-ulit lang yung ating what are the causes and of this of the CKD, no? They say diet ba, mga lifestyle ng tao, and also siguro yung mga other things, no? Like yung exposure natin sa media, yung ito yung mga gamot, tungin natin mga ano yun, yung hindi walang therapeutic claim.
Correct. Yeah, so for the causes of chronic kidney disease, no? So pinaka number one yun, kasi it's very common, diabetes yun, no? So if daily controlled ang sugar, it's a complication of the uncontrolled sugar mo na madaot ang atong kidneys, no? Number two is high blood or hypertension. If taas gyud kayo ang BP dili controlled, no? Na uban na okay lang kay taas ilang BP, like masking 160 wala daw sila gibati, no? So usually okay lang daw, pero usually it has long-term effects kasi, no? So kung dugay na ing nakataas imong BP, it would also lead to complication like pagkaguba sa imong kidney, no? Number three would be atong ginatawag na mga genetic or it could be glomerular diseases, no? So or glomerulonephritis. So these are something there's a primary and secondary, no? So basically these are other mga genetic problems in terms of the kidney. There's also polycystic kidney disease, no? Other common causes of chronic kidney disease is very common. Actually, ang makita is kanang mga sige inom og over the counter na strong pain relievers for long term, no? This can cause actually kidney damage, no? So kanang actually also other herbal medications that are not FDA approved, no? So usually kung supplements, kasi we don't really recommend mga supplements to just take it, no? Without being checked, no? Kasi we don't know really the components kasi of those supplements, no? So there could be some components that may also damage the kidneys long term, no? So basically important lang mo niya itong mga kailangan gyud pangutana first, no? Kung pwede ba or dili gyud.
And in addition lang sir, nga kuan sa ato makinig tayo sa mga, di ba, sa promotion sa radyo, you try to stay away, ayaw gamita tong mag-ingon nga, no approved therapeutic claim. Kay ang pasabot ato, hindi ito gamot at hindi dapat gawing gamot sa anumang uri ng sakit. Kaya ang nabaliktad naman hinoon ilang gamiton. So remember that this is not drugs, this is approved as food supplement by the FDA. They're approved as food, not as drugs. So we are seeing them na mas mataas pang compliance nila kaysa sa kanilang normal drug to prevent hypertension and diabetes. So isa yun sa worry namin. Especially yung mga steroids at saka pain relievers din na pang stop sa gout. Yun yung sa mga taas ng uric acid. Yes, Sir Rodolph.
Kasi grabe naman good yung media, yung advertisement, bombarded na. When I tune in sa AM, kasi yun may sa bukid, yun yung parating advertisement, puro herbal ko and the testimonial, na grabe yung convince yung testimonial para nawala. For example, nawala yung cancer, yung grabe yung yung nawala yung sakit, yung nagbaba ang blood pressure, blood sugar.
Remember that they are selling drugs and they will move heaven and earth. Gamiton lang yun nila, but ang para sa publiko karon nga nagapaminaw, kailangan kay balo nila kung unsa ang diferensya sa testimony o sa studies. Ang testimonya isa lang nakatao nga nagsulti ana. Pero pag ang imo ninyo nag-research siya na usabi ang mga research karon. So sa 10 nga tao, pila ang nabuhi o pila kapatay kung nag-inom kag tambal. Unya pagkahuman ato ang stage 2 sa imuhang research is sa mga 100 ka tao, pila karon ang naay komplikasyon o wala. Unya ang ikatulong nga stage na ang clinical trial nga ginaingon namo is katong 1,000 or 30,000, 3,000 katao, pila sa ilaha ang naayo o dili. Bago mapamatud-an nga tambal sila. Pero kung testimonya nga isa lang ka-tawo or duha, dili na siya maingon nga testimonya kay ang ato ang probability na mag-ingon tinuod na siya is gamay kaayo. So mo na siya nga kailangan nato nga masabtan kung unsa ning prinsipyo nganong mag-ingon ta nga kani tama nga tambal o kani kay supplement lang og herbal og alternative lang. Kay ang ato ang dili lang magud kidney madaot, napoy atay. So since nephrologist kami, ang amo apong ginakuan promote is para dili mga matay ang atong mga kidney cells kay kung maubos na sila wala na kay ang ato ang mga kidney manggod mutigulang manggod as we grow older. So halimbawa 35 years old ka Sir Rudolph, pag 35 daw ka sir ba, kintahay the moment that you're 35 years old 1% of your kidney function 1% every year ang mawala sa imo. So pag 55 years old nimo nawala ng 20% sa imo because of aging kasi we cannot stop aging. Then pag 55 years old nimo every year 2% ang nawala sa imong kidney function. So pag 65 nimo basically 40% na lang functioning. Pero ang mga 60-year-old, dili gyud na dapat mutaas ang kreya. Mutaas ang ilang kreya kung napanay kauban nga diabetes, kung madaot manggod kung dili kontrolado, 5% per year ang madaot sa imong kidney. Ang hypertension, kung dili controlled, 2% per year. So, permi nato na makitaan kung 65 years old ka, nga diabetic ka for 10 years, hypertensive ka for 20 years, mag-dialysis na sila. Bago sila mang-retire, nag-dialysis na sila kay wala na pugngan ang pagdaot sa ilang kidney, kay wala na control ilang diabetes o hypertension nga giingon ganina ni Dr. Escudero. So mo na siya nga kay balo gyud ta dapat unsang tinuod nga tambal og dili. Dili pasabot kay gigamit sa mga artista, ayos siya.
Collagen ba yun?
Di lang ta mo mention kay sponsor man sad siya.
Okay, Doc Alrick, yung let's also ano yung sa mga mga gamot, no, yung mga supplement based on your screening, gaano ka prevalent yung mga tao nag-inom na sila, they will not adi na kumagkuhan sa doc kay wala nang kinabati kasi taking these supplements, these drugs na wonder drugs, parang ganyan, 5-in-1, mga ganon.
Actually, yeah. It's a common question sa clinic, no? Pag makakita may mga pasyente na sila ay mga ginapangutanan na supplements, no? So considering na ang usually I would recommend kasi na to avoid talaga, no, mga supplements as much as possible. Considering na naapod na sila yung mga lain na natambal, no, na ginainom. So basically dili lang isa ilang tambal na kung high blood sila, diabetic, naapod na usually for cholesterol, no? So basically, if the supplement kasi, dili pud ta kabalo if na siya interaction, since wala siya na-studyhan, no? With the other medicines that you're taking, no? So basically, ang daghan inom og supplements, no? But usually, I would recommend to stick on the medications that are prescribed talaga. Kasi ang uban kay ilang undangon ang ilahang mga tambal sa high blood o diabetes kay mag-herbal na lang daw sila. So basically mo pud na ang misconception, no, kasi na nga si Dr. Rabad ang ganina dili siya tambal, no, it's more of a supplement. So basically kung undangon ni ang mga tambal sa diabetes sa high blood, no, mas mapaspas ang pagkaguba sa iyang kidney kay dili na makontrol iya sugar o iyang diabetes, no.
Okay, Doc, I remember there was this book, no, Halamang Nakakagaling na green book.
Yeah. 10. 10 kahalamang nakakagaling.
10,
yes,
ano
10
ba yung kasi
bata pa si Alrick siguro niyan.
uh,
lang na ka, sir.
kay mga tropical country na dagan kay mga halaman. Minsan sagbot na lang, treat na lang nato sa pag-asagbot. Or mga gulay, what sa inyong recommend? Ano yung mga dapat siguro nutritious na mga vegetables, nutritious na food na kailangan natin i-take, no? Para maging healthy ang ating kidney.
Okay. Yung balikan mo na sa 10 yan, nakakagaling na halaman. That was a study done by the Department of Health and promoted during the time of Flavier. Medical student pa din ako noon, Sir Rudolph. Tapos, yung that
Lagundi ba yun? Iba yun? Yung,
yes,
diba, nagsikat yun?
ahos, apil pang ahos at
Oh,
apil pa ang kuan
ang
nato. But
palaya.
the thing is, the longer that they are studied, there is no like basis na nawawala ng kanilang, hindi sila na-prove. Safe sila with, di ba sabi ko kanina, may clinical trial phase 1. That is, marami bang namatay at buhay? Yun ang phase 1. Phase 2 is ano ang complications nila. Sa phase 2 pa lang, maraming nakikitang complications with this number. Kay balo ka bang inom kag 5 ka mahogany seeds, makapatay og ilaga? So remember, mahogany seeds was very rampant before, and we did a study in mahogany seeds. It can kill a daga. So imagine if you were taking a tablet on mahogany seeds, it can kill, especially the liver. So that's just an example na dapat alam mo yung gamot na, okay, buhay ka. Number 2, anong komplikasyon sa liver, sa kidney, sa blood mo? May yung mga luyang dulaw is taas ang bleeding tendencies, and the hematologists are making a compilation of all the case reports that had bled. And number 3 is yung mga sa clinical trial, stage 3 is sa mga, so buhay sila, stage 1. Number 2, ilan ang complication. Now, the 3 is may effect ba sila? Can they work? So doon sila hindi na nakakapasa because sometimes they don't. They really don't work. So that's why we are promoting more on the nutritional health. Now, true, there are many like we could promote healthy living. For us, sa akin ang pinaka number 1 ko, if you don't have any kidney disease, on control of your hypertension, we encourage high potassium diet. High potassium diet
Fiber.
because high potassium diet can create a switch. May switch. Kung hypertensive ka, dapat taas kag potassium because it can lower down your sodium. But if your kidney function is like stage 3, 4, and 5, you have to have low potassium diet. Kaya dapat alamin mo talaga na kailan ka pwedeng gagamit at kailan hindi. Kasi yung iba, sige, kain ka saging kay makamubog BP until such level siya. So, at the same level. So, maybe Alrick, maybe sa mga nutrition natin, yung mga protein natin.
Yeah.
Yung ampalaya, di ba yun?
Yeah, so basically, to promote kidney health, is also one of the factors that we promote is nutrition, no? So basically, sa nutrition, it would entail, depende siya sa kung unsang imuhang na underlying na condition, no? So, example, if you're hypertensive, usually advocate nga low salt diet, no? If you're diabetic, syempre less on the sugars, no? For renal patients, no, usually for a low protein diet, no, usually yung hindi pa nagda-dialysis, we recommend a protein intake of 0.8 gram per day per kilogram body weight, no? For patients who are already on dialysis, there's another their protein requirement is higher at 1.2 kilogram per body weight, no, of protein per day. So basically, iba-iba yung diet depending on your condition. But generally, if you don't have any other health condition, I usually would just recommend to eat everything in balance, no? So lahat naman ng sobra hindi maganda, no?
And at the same time, yung magtatanong, di ba, sir, unsa man ang low protein diet, di ba? So yung sinabi na mention ni Dr. Alrick is yung 0.8. So 0.8 grams per kilogram, pasabot low protein diet ka, so dapat 1 matchbox size lang ka. Isa ka matchbox size na protein with high biologic value. So more on and then kung yung pag karne nimo 1 matchbox size lang, dili mo sobra. The moment you're basta wala pa ka nagadialysis or naka-kidney disease, 0.8 ka. Pero kung nagdialysis ka, then we can allow you to 2 slices of too much back size. But not so much. But yung mahilig na tayo ngayon sa high protein diet and the kidneys parang makulatan na because of the so much
Yung mga
steak and everything.
fitness, no? Mga
Yeah,
tawag
so
yan, South Beach diet.
yeah. It's better to do the Mediterranean diet, yung more on the nuts and the legumes rather than on the ketogenic diet because it's not good for the kidneys. So sa isang plato, 1/2 vegetable, 1/4 ang rice, and 1 matchbox size of fish or chicken, and then or your protein na ganun. More on less ang red meat.
Yung
Enjoy,
kasi
sir.
maraming yung intermittent fasting, di ba ito yung uso na ngayon? Does it help?
So actually, yeah, for intermittent fasting, they usually do that, no, to lose weight, no. So actually, the more effective way of losing weight kasi is more on the calorie counting siguro. So it depends on the amount of calories that you're taking. Kasi masking nag-intermittent fasting ka pero daghan gyapon ang imong ginakaon, no. At different intervals lang, mababawi lang gyapon. Oo. So not really that effective.
Physical fitness, physical activity, does it help kidney function?
Yes. We really promote physical activity, no? So the recommendation, masking dili ka wala kay problem sa kidney, basically recommendation would be at least 30 minutes to an hour, 3 to 5 times a week, no? So one of the activities that we had also during the World Kidney Day was we had a Zumba as well, exercise for the participants.
Doc, one of the major sugar source ng ating sugars is rice, no? And Pinoy mahilig mag-rice, but mahal na ngayon ang rice. Does it help decrease diabetes which will lead to the decrease in CKD?
Yes, correct. So actually rice basically is high carbohydrate, no? So basically we would recommend lang to, especially if you're diabetic, to control your intake of rice, no? Siguro a cup is already okay na.
Para siyang cup, maliit na cup kasi baka malaki.
Ay, kasi
But kasi Pinoy maraming mahilig talaga sa rice, and I think they cannot exist kung walang rice, no?
So bawiin lang siya sa gulay. You can have rice but if you have to balance it if anong trabaho mo. If you're not just nakaupo ka lang, then 1/2 cup lang. Pero kung construction worker ka, then we can have 2 cups of rice or 3 or 2 or 1.
The carbo.
Kasi before our parents, the basic genetic build-up of a Filipino, ang atin is we are fishermen, we are farmers, we are runners. So naglalakad talaga tayo. So before, naglalakad lang ang mga tao. So maraming rice ang kailangan. But right now, may tricycle, may so we have i-balance mo sa activity mo, ang rice mo.
Yung the rise of fast foods, does it contribute sa CKD? Kasi karami dati wala man tayong Jollibee, kung ano na tayo, karinderya, di ba? Remember Davao noong 1980s, wala pa masyado yung mga large multinational fast food chains.
Yeah, just to share with you a study that we did in 2012 when we had this Kidney Week also. We studied high school students. Urinary screening kami sa mga high school ng Indangan versus Santa Ana. Now, the children in Indangan doesn't have proteinuria. The Santa Ana have more proteinurias. And that was 2012. So imagine, konti pa yung Jollibee atong time. So there's an increase, there's a correlation really of being exposed and having lesser protein versus high protein versus more junk food to high junk foods, and at the same time. So we would now know that there is more hypertension right now to the areas with this fast food and maraming mga convenience stores.
Ngayon, mga 7-Eleven, mag-order sila ng yung instant noodles, no?
Which is high salt diet, which is very alarming. So if there's a tax for sugar, we're now promoting a tax also for salt because ang MSG mo, yung mga MSG, mga vetsin natin is 9 times higher salt than the normal salt. 9 times. So imagine the kidneys. Just to imagine the kidneys, parang ginakulata yun the term that I would use in my patients, di ba, Alrick?
Yes. Right.
So, yun yung kwan natin. Very sad. And together with the herbal med, Sir Rudolph, we did a study also in SPMC in 2015. There is more compliance with herbal medications rather than with the regular medicine. So, we need more information. We are really thankful for PIA for this platform kasi sana hindi kayo magsasawa kasi once or twice a year manggugulo talaga kami sa inyo because we need your platform. We need these kinds of chismis that would wala kaming laban because the advertisements are paid. We're just asking help. Yeah, we cannot laban that one. Of course, that's income generating. So we're just here to promote kidney health for us because we're seeing and patients and it's so sad to see them on dialysis and we have limited access to transplant. So yun yung kailangan prevention which is free naman.
May tanong na yung ampalaya ba nakakatulong sa kidney control ng blood ng sugar and sa kidney?
I also did a study on that, sir. O, di ba? Puro study, research backup. That was my study when I was in med school with rats. So, with ampalaya, you need a total of, for rats, you need a total of 2 ampalaya to have an effect on the hyperglycemia. Yes, they have an effect on hyperglycemia na makababa siya. But you need maraming ampalaya. So, and it's not good also because it's not only, you would think na hindi lang yung pang lower down because as this increases the dose, it can also have an effect on your liver. So, dapat balance. But aside from ampalaya, the good thing maybe with ampalaya is it has high potassium. So, it's also promoted to decrease your BP together with other green and leafy vegetables. So it's not like it's ampalaya, it's a treatment already for diabetes because it's really not.
Sabi nakita ko ampalaya, yung supplement. Okay ba yun?
It doesn't, it's not, it has no approved therapeutic claim. So it's not yet as a drug. It's a food supplement. And we don't know. Kasi unlike Biogesic, di ba, Sir Rudolph, we have pag si Biogesic 500 milligram is safe, right? 500. O, si Ingat, Biogesic, 500 milligram. Now, how much will you need to have an effect on this sa isang tao? Kasi, ang Biogesic, kung i-double mo or i-triple mo, magka-liver fun ka na at toxicity and poisoning, paracetamol poisoning. Now, for these drugs, how much dose, ilang tableta yon? Kasi walang milligram pa. Tapos ilan bang tableta? 2 tabs, 3 tabs, 4 tabs na. So, hindi siya pa na-count na anong effect. There is none that is being done. And kung may nangyari man, walang effect ang results nila, which they did, and there's no result. Ang una lang nila, safe lang sila. But the efficacy is not yet there. So, yun yung dapat alam lang ng public kung how to choose their drug.
Okay, kasi kanina sa Healthy Davao Media Forum, yung aming kapihan doon, nag-guest si Dr. Robert Batolom, yung sa colon and rectal surgery, no? And he also, yun din ang problema daw nila kasi people are not, hindi na sila nagkukuha yung cancer treatment because they're going sa herbal. And magpunta lang sila pag worse na.
which is so late. And then, remember the colon siguro na-discuss din ni Dr. Bobby Bandolon kanina na the reason na ini-increase na yung colon cancer is increase na tanin protein and lower na ang ating yung mga vegetables. So, increases the colon cancer, and so hindi lang kidney kasi, may colon cancer and everything else. It all boils down also to proper nutrition talaga for us.
Okay. Balik tayo sa, kasi may correlation yung kidney and yung transplant, no? Because pag makuha na yung hindi na madala ng one of the way to na ma-stop yung dialysis ma-organ transplant, kumusta na yung transplant natin dito sa region na sa kidney, mga kidney transplants?
So, ako muna yun, Alrick, no? But sa dialysis, balik lang tayo, we are promoting na halimbawa masira yung kidney ninyo. Always when you go to your doctor, ask and how many % na ang kidney function nyo. We promote GFR. Tanungin nyo, ano na po ang stage ko? Anong GFR ko? Because we compute every time that you go to the doctor. And if your GFR is less than 30%, yun yung nakakatakot kasi stage 3 na, Alrick, no? 4 na. Pag
Stage
less
4.
than 30. Stage 4 na, pag 30%. Pag 15 is stage 5. When you're stage 4, when you're less than 30%, doon pwede kang mag-prepare for transplant. Doon, hindi mo na dapat abutin ang dialysis. At stage 4, pwede ka nang mag-prepare. Or kung ayaw mo magpa-transplant or wala kang donor, magpagawa ka ng fistula na sinasabi namin. This is the time to see your nephrologist, not on the time na ida-dialysis ka na. So, that's the time na i-prevent natin from the complications. Pero mahirap na pong i-prevent from dialysis. But don't think that when you're on dialysis, ikamatay. So yun yung namin, Sir Rudolph, na pag i-dialysis, ang thinking ng mga tao, pag i-dialysis ka, mamamatay ka na. But actually, hindi. When you're on dialysis, it extends your life while waiting for a transplant. So, imagine your car na nasira yung filter, okay pa man ang kaha, dalaot lang filter. So, you just need to clean up your body because ang toxins ng body mo dumadami, kailangan mong tanggalin because ang kalaban mo, yung creatinine. Yung creatinine mo, yan yung dumi ng katawan mo. Yan yung dapat tanggalin mo. And sa lahat ng organs ng body, tayo lang, Dr. Escudero, di ba, ang may machine na pwede naming tanggalin yung toxin. Kung masira liver mo, wala silang machine. Masira ang heart mo, wala ka na. Masira brain mo, wala na. Pero masira kidney mo, there's still hope. We have dialysis that can extend your life up to 20 years or transplant that can stop dialysis. So, hindi kalaban ang dialysis. Ang kalaban, creatinine, na maka-stroke at saka maka-heart attack. So, basically, yun yung. Alrick, anong madagdag mo siya doon sa dialysis?
Regarding misconceptions about dialysis, no. So pag ginastoryan ang dialysis, dili na mahadlok na gid ang mga tao
Pag death sentence,
no. Oo, murag death sentence, but it's not, no. Especially if you're young, no, tapos naguba imong kidneys, it's actually would help you to go back to your usual activities in just that there's dialysis, no. Kasi actually ang ginahimo sa dialysis is it helps control ang imong symptoms, no, because of the very high toxins already in the body. So there are actually options, no. So usually yun nga sabi ni Doktora, when you're already at stage 4, we already discussed the options of treatment, no. So that would include your peritoneal dialysis mo nang ginahimo sa balay, hemodialysis, and basically the treatment for a failing kidney would just really be a kidney transplant, no. So actually dialysis is just a bridge to kidney transplant, but it helps people, no, to go back to their usual activities, like ang uban nagatrabaho pa, no, kasi basically ang dialysis is also flexible, no. It depends. So example, nagatrabaho ka sa buntag, ang uban nagapa-dialysis after, no, sa gabi ay sa hapon, no. Then kung hapon di mo work, usually they do dialysis in the morning. So it's something flexible. What it does is it controls you from the symptoms that you have, no, because of the among ginatawag uremia, no. So usually ang mga simptomas ani is nagaluya na, paspas makapoy, no. Usually dialysis also controls yung fluid, kaya ang uban nagahupong kay nagahinay ng ihi, no, which is another function of the kidney. So another symptoms kay kanang mga dili na sila kayo makatulog og tarong, no, ug ang uban mawala sa wisyon, no. So those are really symptoms of the very high toxins already in the body and are actually indications already na kailangan na madipyuhan, no. So as early as stage 4 nga, it's really good to prepare already kasi syempre medyo disudpod, no, pag especially if stage 5 na ka tapos naingnan na ka na mag-dialysis, most of the patients cannot really accept, no, especially the first time. So really we have to talaga prepare them.
Madagandagan gid sila sa amo, Sir Rudolph, ba nga kung dili padakpan. So ang only way na halimbawa pwede pa naming ma-delay ang dialysis, but kailan kami nag-dialysis? Pag acid na talaga ang dugo, pag manas na hindi na makahinga, pag ngisay na, meaning nag-seizure na or hindi na kailan, nagsalimuang na, or ang potassium taas nga magdaot na ang kasing-kasing. So mo na, may emergency siya dialysis, pero pwede good nga maplano nga dili siya magdakuan o gasto. So initiation of dialysis will need only 3 days to 4 days admission.
Yeah.
But kung ma-complicate lang, maabot kag 20 days sa ICU, which we wouldn't like to prevent. But the best talaga treatment is really a kidney transplant. So going to your question kanina, Sir Rudolph, na about kidney transplant, we are doing kidney transplant in SPMC. Kay daghan kay wala kahibalong naga-transplant di ay ang Davao City. We are doing it since 2002. We have done about more than 200 transplant in SPMC and about more than 70 to 100 in Davao doctors. And we have one transplant center also in DRMC. So it's available in our area. We offer the Z package of the PhilHealth the Z package PhilHealth will give you 600,000 pesos for transplant. So it now will lower down the cost of treatment for renal failure. Kasi ang dialysis, sir, forever siya. And every month, a patient with i-compute mo ang PhilHealth niya and pamasahe niya, pagkain niya na walang oras, will cost about 30 to 50 to 70,000 pesos a month. But with transplant, one time, big time, but you can live and you can go back. And it's available to our people of Davao. At the same time, they can ask help up to for the copay. So hindi mahirap magpa-transplant. Ang mahirap maghanap ng donor lang.
But yung donor, dependent niya sa transplant, dependent sa availability na to donated organ.
Oo. So nakita mo man siguro na may baboy na nag-transplant. Uso yun na nabalita, Sir Rudolph, di ba? Alrick, nakita mo yun. Genetically.
Yes.
Ano yun siya to? Apply na pwede baboy, kidney ng baboy?
Yung hindi siya basta-basang baboy, Sir Rudolph. Bale, genetically altered. So, tinanggal ang mga sakit na makakasira na genes ng baboy, tinanggal yung mga genes ng baboy na makaka-affect sa tao na magre-reject. And then pinasukan, ininjectionan yung kidney ng baboy ng genes ng tao para ma-accept ng body. Tapos, yung recipient, i-injectionan ng immunomodulator, meaning i-arrange na po ng katawan ng tao so that they will not reject and accept that. So, the first, isa pa lang yun, but it is parang compassion use. And so, it's still, number one, a living donor or a deceased donor ang source. A living donor is the ones na kapamilya mo, mahal sa buhay, that would be the same blood type or compatible blood type. So O to O, A to A, and O can give to all, but O can receive only to O. So yun yung basic principles ng transplant. Pero for our patients, the longevity of life, we have patients na 40 years, we have 20 years sa ating settings, they are living and enjoying their life. So, ang living donor kasi, swerte ka kung may kapatid ka. Paano kung wala? So, you need to be on the wait list. So, sa wait list, meron din tayong wait list sa Davao. So, we can now facilitate kung wala kang donor, magpalista ka, and if ever may donor tayo na may donor family na mag-agree na ibigay ang kidney ng kanilang loved one during the time of the death of the loved one, then ibibigay natin doon sa naghihintay. So that's really a full cycle na. A full cycle for that.
How much does a package cost na transplant? I know 600K PhilHealth package.
Okay. So ang transplant sa SPMC is 1.2 million. But may PhilHealth ka, 600 na lang, and then the rest of the 600, pwede kang i-classify na no balance billing ba, 200, 400, 600, depending on your class. May i-classify ka naman ni SPMC, and you can 30% of that to 50% of that, pwede mong ma-care off sa malasakit, sa lingap, sa DSWD.
Meron ng yung indigent na naka-transplant na wala talaga siya nabayaran.
Yes, no balance billing. And they are screened by the social worker. Yung talagang totoo. Tapos ang iba kasi no balance billing kami, naka-try kami, nag-apply siya no balance billing kasi indigent ang hawak niya na card. Bakit yung ma-transplant, mas dako pa yung sakyanan kaysa sa amo sales. Kaya yun yung, we have to screen these people who deserve it talaga. So, the indigent can also...
Okay naman yung success rates ng transplant sa SPMC.
Yes, the survival rate namin, 1 year survival rate namin is 98%, and the 5-year survival namin rate is 80%. Comparing to to dialysis, survival rate after 1 year is 80%, and survival after 5 years is 50%. So, lesser ang survival natin, patuan talaga, lower ang survival rate natin sa mga dialysis compared to transplant.
Unfortunately, time has run out. Sarap ating
tabi na natin.
Alas 3. So we like to thank Dr. Alrick and Dr. Theresa Badang, again, our Shuki. Parting statement or any announcement? We'll start with Dr. Alrick.
Basically, I would like to promote again kidney health, no? So I will just reiterate lang ang 8 golden rules, no, to keep your kidneys protected, no? So number 1 would be eat a healthy diet. Number 2 would be to check and control your blood sugar, no? Number 3 would be to check and control your blood pressure. Number 4 would be to take appropriate fluid, no? So the recommendation is at least 2 to 3 liters of water a day. Do not smoke. Don't take over-the-counter anti-inflammatory or painkillers. And get your kidney function checked, especially if you have risk factors like diabetes, hypertension, or you're obese, no? Or have a strong family history of kidney disease.
Okay, Dr. Theresa Badang.
Thank you, Sir Rudolph. Suki na. Kaya nagdala na ako ng mga new faces ko, sir. And mga new faces. Thank you for Sir Dr. Alrick for coming in together with me. Sa atin will be a kidney month na talaga ng DOH and then November is donors month. So we will have more promotional activities on that. So sa akin is yung number na 52221. 5 na mga servings of fruits and vegetables. 2 hours of screen time lang. 8 hours of sleep. Yung mga cellphone natin, 2 hours lang dapat because it can promote yung mga diseases. And then 2 liters of water a day. 2 grams of salt, meaning low salt diet. And then 1 hour of exercise 3 to 5 times a week. So para mas healthy tayo and happy. And don't forget that your nephrologists are we are your friendly nephrologists, and we are here not for the dialysis, but we are here to prevent the kidney disease.
How many nephrologists Davao City or Davao region?
5
Spread
with the
all over.
pediatrics, with the pediatrics na. We have 5 the pediatrics, 20 na adult. Dami na kami.
And training, di ba? May mga in training pa na fellows.
So we're doing fellowship training at SPMC. We have 10 graduates per year. So yung mga kasuluk-sulukan, that's why it's increasing also, because there's increasing identification na of patient.
Parang marami na nag-screening, like yung kay Dr. Bandolong na marami na yung na-discover silang rectal na cancer disease because marami na rin screening awareness.
Thank you.
Thank you so much, Doc.
Thank you, Ma'am Karina, at saka Ma'am Jamin. Thank you, Sir Rudolph. Thank you for having us.
Thank
Okay, happy
you.
birthday pala kay Karina Kayo.
Ay,
Happy birthday.
Thank you very much for having us. Birthday gift na lang namin to sa'yo.
Hindi.
Thank you. Thank you. Happy Holy Week na.
This has been Rudolph Alama of Philippine Information Agency. Till next week, more relevant topics to discuss here at One Davao.
Mga importanteng pahinumdum bahin sa pedestrian lanes o pedestrian crossing sa dakbayan. Sa pedestrian lane o pedestrian crossing, kinahanglang mo preno ug muhunong ang mga sakyanan alang sa sibisan kinsang motabok, ilabi na ang mga bata, estudyante, senior citizens ug mga persons with disability. Ang driver nga madakpan tungod sa wala pagrespeto sa pedestrian lane, makamulta og dili moubos sa 200 pesos tungod sa violation of pedestrian crossing rules. O posibleng dili ma-renew ang rehistro sa sakyanan. Alang sa mga manabukay, kinahanglan nga alerto ug magmabidantayon sa dalan sama sa paglikay sa paggamit og cellphone o di baka mga gadgets kung motabok. Hulata nga muhunong ang sakyanan una motabok. Importante sab nga motabok sa mga saktong tabukanan gamit ang pedestrian lanes o overpass. Ug sa mga sakyanan nga maabtan og stop sign sa intersection o traffic light, bawal muhunong sa pedestrian lane. Kinahanglan nga wala nakatamak ang ligid sa pintura sa pedestrian lane. Ang driver nga makasupak niini dunay multa nga 500 pesos tungod sa disobedience to official traffic road or pavement markings. Pwede sab nga maapektuhan ang pag-renew sa rehistro sa sakyanan. Samtang kung ang driver hapit makadisgrasya og manabukay sa pedestrian lane, pwede kining i-charge og reckless driving nga dunay multa nga di moubos sa 1,500 pesos. Pahinumdum sa mga motorista ug sa mga manabukay o mga pedestrian, sundo nato ang mga traffic signs ug balaod trapiko arong malikay sa disgrasya. Ang disiplinadong Davaoenyo mutuman sa balaod trapiko.
Walang higit na puwersa kaysa isang babae na nagpupunyagi at nagtatagumpay. Sa pagdiriwang ng Buwan ng Kababaihan, nakikiisa ang Philippine Information Agency sa Lipunang Patas sa Bagong Pilipinas, Kakayahan ng Kababaihan, Patutunayan. Tunay na ipinamamalas ng kababaihan ang kanilang kakayahan at husay sa ating lipunan. Ang kanilang tagumpay at kontribusyon ay patunay ng kasiglahan at kaunlaran ng ating bayan. Kaya't hinihikayat namin ang lahat na maging bahagi ng pagpapalakas ng kababaihan. Bigyan natin sila ng espasyo upang ipahayag ang kanilang mga boses at maisakatuparan ang kanilang mga pangarap at layunin. Higit sa lahat, patuloy nating isulong ang patas na pagtrato at pagkakataon para sa kanila dahil ang kanilang tagumpay ay tagumpay ng buong lipunan. Sa ating pagkakaisa, patunayan natin na ang lakas ng kababaihan ay tulay sa paghubog ng isang mas maunlad, makatarungan at patas na lipunan. Mabuhay ang mga kababaihan ng Pilipinas. Mabuhay ang lipunang patas at makatarungan para sa lahat. Abante, babae!
Disaster Watch. Paghahanda bago ang lindol. Alamin ang mga maaaring magdulot ng pinsala sa inyong lugar. Maging pamilyar sa mga sumusunod: fire extinguishers, medical kit, exit routes, evacuation plan. Siguraduhing matibay ang bahay at paayos ang mga sirang bahagi nito. Ayusin ang pag-iimbak ng mga nakalalasong kemikal at mga bagay na maaaring maging sanhi ng sunog. Siguraduhing ligtas ang pagkakalagay ng mga mabibigat na bagay. Ihanda ang go bag na naglalaman ng mga kinakailangan. Makipag-ugnayan sa mga lider para sa plano sa paglikas. Pag-usapan din sa pamilya kung saan tutungo sa oras ng kailangan lumikas. Makilahok sa mga pagsasanay ukol sa lindol. Sa panahon ng sakuna, dapat laging listo.
Sa isang iglap, maaaring matupok ng apoy ang iyong tahanan, pinagkakakitaan, at ang pinakamatindi ay ang iyong buhay. Ayon sa Bureau of Fire Protection, mayroong 15,679 na insidente ng sunog mula Enero 1 hanggang Disyembre nitong nakalipas na taon. Nakababahala ito sapagkat bukod sa patuloy na pagtaas ng datos ay kapansin-pansin na ang mga sunog ay karaniwang nangyayari sa residential areas. Kaya naman sa pagpasok ng tag-init, higit na pag-iingat ang kailangan upang makaiwas sa sunog. Makiisa sa Fire Prevention Month, maging responsable at wais sa paggamit at pangangalaga sa ating tahanan, opisina o pampublikong lugar. Ugaliin ang regular na inspeksyon o pag-check ng appliances at kuryente upang makatipid at makaiwas sa trahedya. Maging responsable rin sa paggamit ng kandila, kalan o mga gamit na maaaring pagmulan ng apoy. Maging alerto, maging fire safety ready.